Hey there, this is Dr. Evan Osar with Discover IMI, or Integrative Movement Institute. Happy Sunday. Here we are, Sunday afternoon. Hope your weekend has been going well. You're getting some well and needed rest. Yesterday, I had a call with our Integrative Movement Specialist Ambassadors. That's a monthly call that we do to help up-level their skills as well as touch on topics that they may have questions on. We also presented at a facility about an hour away from me here in Houston. We were discussing balance. And in the earlier call, we were discussing the ankle and foot complex. Now, balance is really a way that your nervous system organizes the information it's receiving through the vestibular system, through the visual system, as well as through the myofascial system or the somatosensory system to collect the information and then create the appropriate response and then create a motor output so that you can maintain your center of mass over your base of support. So if you're walking, you're transitioning your center of mass between each foot. You're slightly rotating to one side and then counter-rotating back to the other side, and then it creates this nice smooth and symmetrical and efficient gait pattern. What we see with a lot of our clients is we see that valgus knee position. And one of the things we don't often hear about, or I should say first, we often hear about that the valgus knee is an issue just with weakness around the hip, or tightness around the hip as well. So tightness of maybe the adductors, weakness of the abductors. And then we do a lot of strategies to strengthen the abductors and lengthen the adductors. And for some clients that may help or provide some temporary relief. But for a lot of clients, it does not. So I want to think about or bring your attention to what happens often down at the knee, what causes the valgus knee position, and oftentimes the overlooked cause of the valgus knee. When we think about keeping our center of mass over top our base of support or our feet, it's really about organizing the head, the thoracolpelvic cylinder, so the rib cage, spine, and pelvis, and then organizing the lower extremity, the hip, knee, ankle, and foot. What we also will tend to happen, or I should say what will tend to happen over time, is we start to create rotations. Now, you could have tightness, and again, we could go through several different iterations of this, or there's many different, almost an infinite number of iterations. Why are some people rotated? Their pelvis may be rotated to the right, for example. Well, if you think about it, if your pelvis is rotated to the right and you don't compensate for it, you'd be walking like this, okay? Your whole body, your whole center of mass would be maybe over your feet, but you'd be rotated and turned to your right side, okay? Now, you wouldn't walk like that because it's not very efficient. So what do you do to keep your eyes level and looking straight forward? You'll counter-rotate somewhere. Now, there's many areas of the body that you can counter-rotate. A very common area, a very easy area to rotate is through your thoracic rings, or the rings, ribs number 1 through 10 that form these rings. You can counter-rotate very easily, and that's why so many of our clients, they'll have rotation through their thorax, or they'll have rotation through their spine. They're counter-rotating for something somewhere to keep the eyes level to the horizon, this way, and then keep the eyes straight forward. So that way when you're walking, your center of mass stays between your feet and your visual gaze or your vision stays looking straight forward. Now, another area where many of our clients can compensate for rotation, just again, let's go back to the pelvis rotated to the right. Another common area your client can compensate is through the ankle and foot and knee. We'll add the knee to it. So what can happen is, if my pelvis is rotated to the right, I can actually bring my knee, I can rotate through my femur and or through the tibia to bring my knee in. And unfortunately, the camera's up too high for you to see this. So just visualize this. Pelvis rotate to the right. You can even do this with me. Rotate your pelvis to the right, and now bring your knee into a valgus position, and you'll notice it kind of rotates you back so that your center or your vision is going back straight. So now your knee is in a valgus position, even though your pelvis is relatively still rotated that direction, and now at least your pelvis now is facing more forward. But again, now you've got that rotation and compensation through your knee. Some clients they'll actually, as they're doing that, so just visualize it, again, the knee being on top of this foot model, the knee is going that direction, the tibia is abducting, the femur is adducting. Well, the foot could either collapse if the person has a very mobile foot, or the person will just roll onto the inside of their entire foot if they have a more rigid type foot, or they'll just rotate that. Here's a very common cause of this. The individual will rotate the tibia externally. So now the person, when you watch them squat, for example, you'll see their foot really turned out. It's not that the foot is turned out. I mean, technically it is, but it's not the foot that's actually rotating. It's the actual tibia that's rotating. And again, that's the compensation for the rotation at the pelvis. Okay, so, hey buddy, my best friend back home, Pete, good to see you, buddy. Thanks for being on. So again, a lot of the things we see down lower are actually just compensations for rotation up above. Head or neck, mostly neck, thorax rotation, even pelvis rotation, and then the knee takes a beating for that. So one of the things we want to look at is, as I was describing to the group yesterday, is we want to look at the thoracolpelvic cylinder. We oftentimes will work on getting this aligned so that way we take away some of the compensations for the rotation up here. Now, somebody asked me, like, do you start there or do you start down at the ankle and foot? It really depends on the cause. Again, we will do a very thorough assessment to determine the cause of why somebody's in rotation. But I'll generally look at the ankle and foot, change that. So just to say example, take for example, just say your client has a collapsed foot. Well, then if they're wearing orthotics, for example, or maybe not, maybe they're wearing supportive shoes or gym shoes, put them in their shoes and see if it takes away some of the rotation. If it doesn't, then it may not be coming from there, or it may tape up their foot. They may tape the arch up to create a better foot tripod and see if that takes away some of the rotation up above. If it doesn't, then maybe it's not the ankle and foot. We can also take some of the rotation out, so maybe I'll bring the pelvis back to where it belongs, where the TPC, that thoracolpelvic cylinder, is better aligned. Does that improve the knee? So we're always looking around the knee first so that we can see, is the knee issue a compensation for something down at the ankle and foot? Is it a compensation for something up above at the pelvis, the hip, and or through that thoracolpelvic cylinder? And then what we'll do is, even if it is a compensation, oftentimes there's a muscle imbalance around the knee. So if we think about, just visualize like in between my hands is the right knee. Well, the tibia can externally rotate as a compensation, and that's part of that valgus knee position. So just visualize the right knee going into valgus, and the tibia externally rotates. Well, one of the things that will compensate, or should say or the muscle changes that happen when you have the tibial external rotation, is your biceps femoris gets short and tight. The medial hamstrings, so the semitendinosus, semimembranosus, they will get over lengthened. So now this muscle imbalance between the lateral and medial hamstrings starts to perpetuate that knee rotation. So even though the issue may not be driven from the knee itself, it may just be that compensation that still needs to be addressed. So even though I'll still work on wherever the primary issue is, the underlying cause is, the thorax or the pelvis or the ankle and foot, I will still have to address that muscle imbalance around the knee, because again, if somebody's had this for a long time, if your client has valgus knee position, they've probably had it for a long time, so you want to address that muscle imbalance. So we'll lengthen the biceps femoris, we'll shorten and work on the tibial rotation. I just did a video for Instagram where I demonstrate exactly how to do that. So you can check us out at Discover IMI. So Discover IMI, one word, on Instagram, and I'll show you a series of releases as well as activation and how to integrate that into an upright position to change that tibial rotation. And that's been very, very effective for us working with clients with chronic knee issues in that valgus knee position that isn't related to weak glutes. And very frequently, not that the clients don't need to strengthen their glutes, because many of them do, obviously, but it's not the driving issue, and the weak glutes are really just a down the chain, so to speak, problem that results from more of the primary compensation. So look at your knee rotation, look at the video that I shared on Instagram. It may even be here on Facebook, I'm not sure how that works. So check that out. It shows you one of the most effective strategies that we use for our clients, and it'll give you an idea of how to address that tibial rotation. And again, you want to look again at the ankle and foot, and you want to look up above, because remember, even though we talk about isolation, it's always this integration. We want to look at the isolated component, because you may have to address an isolated component, but it's always how the pieces stack together. And that's what we call it, the integrative movement system, because we want to look at how this each area of the body integrates into creating the most optimal. There's an optimal way to move, to a more optimal way, or a most optimal way for each individual. And there's an efficient way. You can move efficiently, or you cannot move efficiently, or you may not move efficiently, and that will drive a lot of our clients' issues. And ultimately, our approach, your approach, even with what you're doing, is you want to help your clients move most optimally, most efficiently, because that will help them do the things they need to, the things they want to, and oftentimes help them get back to the things they love to do, especially for those clients who are struggling with chronic issues like knee valgus issues and or knee pain, things like that. So I hope that makes sense. Check out the video on Discover IMI, and if you're looking for more information, join us at Two Anatomy Geeks, where Jill, my fellow anatomy geek, and I will take you through the anatomy of knee rotation more in depth. We'll look at some strategies of how to release that lateral hamstring. I'll go a little bit more in depth into the strategy I shared on Instagram. We'll discuss how to activate the internal rotators of the tibia to pull the tibia back underneath the femur where it belongs, and then also how to set up the foot so that way you can help more clients with knee, ankle, and foot issues, which will help their balance, will help their posture, will help their movement. Ultimately, that's what we're trying to get our clients to do, is to move more optimally, move more efficiently. So again, they can return to those things or continue to do those things they need to, want to, and love to do. The link is in the bio here, up above this video, wherever you're watching it. The link is next to this video, maybe where you're getting this information. If you're watching a recording, it's in the newsletter or so forth. We'd love for you to join us at Two Anatomy Geeks. It's a great community, a wonderful community of like-minded individuals that are looking to up-level their knowledge, their skill sets, so they can help more clients and differentiate themselves in the industry. So this is Dr. Evan Osar with Discover IMI, Integrative Movement Institute. Look forward to seeing you at Two Anatomy Geeks, and check us out on Instagram, Discover IMI. We post there quite frequently. Tips, strategies, and things that will help you be the best leader that you can be for your clients. Keep leading your clients, keep inspiring them, empowering them to do those powerful things that they can do, take care of their mindset, their nutrition, and their movement, so that that way they can live their best lives and lead their communities as well. And that's how we can ultimately make the biggest difference in this world. Make it a great Sunday. We'll see you next time at Discover IMI. Take care.